So as you can tell from that introduction, most of my resume looks like a medical CV these days. There was a day when I spent a little bit more time on the business side. And actually, I was just wondering how I ended up here after 10 plus, 15 plus years, maybe even longer now, within the medical community. And I think the real reason why Priya tapped me to join eMed events didn't really have anything to do with the fact that I have an MBA and an MD in a combination. It was actually the result of the recent Business Week rankings, where my alma mater, Duke, actually outranked Harvard, which is Priya's, for the first time, and we were #1. So the reality is that Priya hired me under the adage of, if you can't beat them, then hire them. So my introduction to eMed events is through Priya and actually through Dr. Spitz here. It was an unexpected meeting. I'd signed up for a conference on epilepsy so I could get more CME and learn more. And before the conference started, Dr. Spitz introduced Priya to us, who then took up the spotlight and talked about her vision for eMed events and what it would be, and asked for our input and our support. And I was very impressed with Priya. She had a lot of poise. She was clear. She clearly had drive, and her business plan was well organized, even in the short presentation she was giving us before our lectures. So I decided to learn more about what was going on with eMed events at that time. And the more that I spoke with Priya that afternoon, I realized that she had several unique characteristics which I thought were important and were probably going to make her a winner. The first was that her business acumen isn't good, it's superb. And the business plan that she has laid out and the trajectory for this company is tremendous. And then I think maybe most importantly, this is a woman and a group of people that I'm now meeting and getting to work with more, who are driven by right principles. And what I mean by that is that first there's a desire to support and serve others, and then from that desire, they build the business and then their fortunes, rather than the other way around. So I thought this is very important, especially if I were going to be getting back involved in business to the same extent that I have been involved in medicine so recently. It was a number of months later when Priya approached me and asked me if I would be willing to review the site and take a look at it both from the perspective of the MD, the end user, and then also from the MBA. And then she asked me for more. She said, by the way, do you have any friends that you could get to review this site? And then she asked me for more again. She said, could you do that by Wednesday? So, and then you know what happened, right? Because when Priya asks you these things, you end up saying yes, and the next thing you know, you're doing it, and then a lot of good things happen. So that was sort of how the initial introduction started. When I got into the site, honestly, I thought it was good in a number of ways and had some excellent features, and but I think it came up short in a couple of points, and so I said so, and I didn't pull any punches. You know, I think a Harvard MBA can hear it when there's something that's not quite right. But what happened next really impressed me. It was about 2 minutes later that Priya had me on a phone in front of my computer, leading a meeting with the chief programmers in India as to how we were going to fix this site and improve it. 2 minutes. And less than 8 hours later, almost all the points that we discussed were fixed. They were changed. The site was better. It happened that fast, and it keeps happening that fast. So eMed Events is a company and has a website that evolves very rapidly. If you think you like what you see today, just wait a week and take a look again, because it'll be even better than that. This is also a good thing because the market keeps changing and moving very quickly. So that was my introduction to the company, and I want to give you a perspective from my perspective as a doctor as to why I think what it's like to be a doctor today, and why I think that eMed Events is going to provide the services that we need. So I'm a board-certified neurologist, and that means, though, that I still have to take 270 hours of continuing medical education before I can go and take my board certification again. And if I don't take those hours of education, I can't even sit to take the test. So, and I'm not alone. I mean, neurology is only one of all of these specialties. Every single person who has finished with their training in the last 15 or more years is obligated every 10 years to go back and take this test again. And I guess what I'm trying to say is that somebody changed the rules on us. You know, there was a time when you got board certified, Mark, and then it was okay that you didn't necessarily need to continue to stay up on your game, but the times have changed for the better, and now we do. And what does that mean? That means that I have to take a lot more education, and that means I have to go to a lot more conferences. Do you think that I have the time to organize that? No, I don't have the time to do that. I'm busy seeing patients and doing other things. Would I like to have a great conference experience? Yes, I would. So from a very personal standpoint, from this experience, it's very clear to me that eMed Events has positioned itself brilliantly. The timing is perfect, and the growth is bound to happen. So I'm very excited. With that, I think I'm going to close my comments on this, and I would like to introduce Dr. Mark Spitz. It's actually my great pleasure to do so. Dr. Spitz has been one of my professors when I was a resident. He's absolutely one of the smartest men that I've ever met. One of my favorite teachers. He's been called one of probably the best epileptologists in the state, if not the West. He's a collector of vintage ties, a chess master, a polymath, and from my perspective, none of that matters. Because what really matters is the gift that he gives his patients every day. And it doesn't matter if the patients walk funny, or can't talk right, or dress weird. It just doesn't matter to Mark, because Dr. Spitz sees each patient as they truly are, as a human being first, deserving of respect, dignity, support, and caring. He sees them as a person. And at the moment when they meet in his office, Dr. Spitz's patient is the most important person in the world. Ladies and gentlemen, Mark Spitz.